Hello and good night, everyone. Welcome back to Shanzen Zen Jamaican Vibes. Tonight is such a wonderful night for me. I've been reunited with a childhood friend. Oh my goodness. And as you know, October is celebrated as Breast Cancer Awareness Month, both in Jamaica and across the globe. And tonight, I'm honored to welcome Dr. Ornesha Watson, an accomplished associate director leading work in psychiatry and community health initiatives across United States and the globe. So good night, Ornesha, and welcome. Thanks for joining me. Can you just give us a brief introduction of yourself and share a little bit about your background, and your connections here in Jamaica?
Thank you so much. It's such a privilege to be here with you tonight. And like you said, to be reunited as we both grew up in St. Elizabeth.
Yes, yes.
So, as you mentioned, my name is Ornesha Watson. I am from Jamaica, born and raised, and migrated to New York for college as a teenager and have since stayed and lived and worked here in New York and across the world, to be honest. Um, in terms of my professional background, I am a pharmacist. I have been working now for about 5 years in the pharmaceutical industry. And before that, I worked with the United Nations. So I focused on international development, working a lot on projects that really impacted women's and children's health. But just on a lighter note, I think I like to think of myself as someone who just enjoys giving back, and because of that, I was just so easy to say yes to being on with you because I think that's something we definitely have in common. Love the work that you're doing, especially right there in our home parish. So thank you again for having me, and really excited to have this conversation with you today.
Thank you. You're so kind. You're so kind. All right. So, as you know, Breast Cancer Awareness Month here in Jamaica, it is celebrated in October, and there are a lot of persons who I know have stories similar to yourself, but they are not so forthcoming as to publicize or share their stories to inspire others. What would you say to those persons, and why did you choose to share your story? Yeah.
Well, thank you so much, one, for the platform to share the story or share my story.
Mhm.
And I think, so working my way backwards from your question, one of the most important things for me to share my story is because I think it can save lives. At the end of the day, that's the most important thing. I think when we don't know and we don't know what to expect or we don't know what to do, ignorance can really lead to lack of action. And so when people hear the dreaded C word, they get very scared and they don't necessarily know what to say to someone, either if
Yeah.
it's they themselves, like if you get that diagnosis, you're not sure what to do with that. But more importantly, the people around you don't know what to say to you or what to do. So for me, like you mentioned, October is celebrated as Breast Cancer Awareness Month here in the US and, of course, in Jamaica. And so I thought it would be really important to share my story during this month to help build awareness about the importance of one, getting screened for breast cancer, and then two, what do you do? Like, what can you do and what does it mean? So, like you mentioned, I was diagnosed with breast cancer back in January of 2023. And when I got my diagnosis, I was fairly young, very young compared to the age group that typically gets breast cancer. And a lot of folks who I remember one of the doctors that I met with said, you have a very common cancer, but in a very rare patient. But no, honestly, it's getting way more frequent that you're seeing women under 60 getting breast cancer. Right. And so, because of that, I think it's important for us as young women to share. For me, I did not have a single symptom. I literally was lying down in bed one night and decided, because I would usually do like the self-examination that we're encouraged to do. I'd usually do it now and then in the shower, but I was laying down in bed this night and decided to just start circling my hand from like the outside around my breast, and you work your way in just to
Mhm.
feel if anything felt out of place. That's typically how you do that self examination. And starting from under my armpit and working my way down, I felt this little thing. It felt like, I don't know if you know, like a little tiny seedless grape. It
Yeah.
felt like that's what it would. And I was like, no, this doesn't feel right. I don't remember. And I had just done my annual physical like earlier in the year, and there was nothing there at that time, right? So feeling this lump, I decided that I wasn't going to ignore it. That's the first thing. If you feel something that feels out of place, make sure you go check it. Don't bother just pretend that it's not there, because some of us, we think if we ignore it, it goes away.
Yeah.
That's not the case. So I decided to go to my gynecologist and tell her that, hey, I felt this lump that did not feel like something I had before. And she said, Ornisha, we're going to be on the safe side and send you to do a mammogram. Now,
Mhm.
because I was under 40, which in the United States and for a lot of countries, the recommended age to start getting mammogram is either 40 or 45, right?
Yeah.
So I was under 40 at the time. And so going to get the mammogram, the first thing was navigating that health system, because usually you're not, routine, you're not getting routine mammograms. So I had to make sure that I followed up with the doctor to say, I also need to get an ultrasound, not just a
Mhm.
mammogram. And that's one recommendation for women who are, it's your first mammogram, especially if it's because you felt something. It's important that you get both an ultrasound and a mammogram that first time around. So I did that, and they come back and they say, "Hey, Arnisha, your results are inconclusive." That was the day at the mammogram or the radiology office. They said it looks inconclusive, so we want you to come back and do a follow-up biopsy to make
Mhm.
sure to see what it is. And another comment that they mentioned that didn't really mean much to me then, but I've since done research to learn more about how common this is. She
Yeah.
said, and there's another thing complicating our ability to see what's going on. She said, for a lot of young and Black women or minority women, you tend to have what they call dense breast tissue. So because the breast tissue is dense, when it comes on the imaging, it's hard for them to see exactly what's going on when you have a lump. So they
Yeah.
wanted further testing. So went on, got the biopsy done. The result
Yeah.
came back in about a week or so after doing the biopsy, that it was breast cancer. And so now it's like life kind of go from before cancer to after cancer, because it really changes a lot of who we are, what we do. So fortunate enough, because of where I was living here in New York. I had access to really amazing care and services. I was able, within a month and a half of finding out that I had cancer, I was cancer free. And that meant that I got surgery and removed the cancer like less than two
Amazing.
months after getting diagnosed. And
Yeah.
that's a luxury. I know that's a luxury. And that's what I want for people in Jamaica and women in Jamaica, that we can have that quick access to care.
Right. And how has your journey, how did your journey, how has it shaped you into the woman you are today?
Well, I will say that one of the things that it has done for me is create made me less of a procrastinator in my personal life. I think we're all guilty sometimes of planning to do something and then like, oh, it can wait. But I really have an appreciation for time, because
Yeah.
when you get that diagnosis, before you know how far along you the staging is, if it's early or late stage, there's a lot that goes through your mind, wondering, what how much time I have, like
Yes.
with your family, with your friends. And so for me, it's given me a really new perspective on time and really maximizing the time we had. Luckily, my cancer was early stage. So with
Mhm.
surgery and chemo, I was able to really get rid of the cancer, and also the chemo helped to reduce the risk of the cancer coming back. And that's one of the misconceptions that people have, that sometimes chemo is something that you use to get rid of the cancer alone. For
Yeah.
some cancers, the chemo is used to help prevent a recurrence, so that it
Oh.
lowers the risk of the cancer returning. So that was the reason I had chemo after surgery. So you'd say, well, if they take out the cancer, why are they still giving you chemo? Well, the chemo in my case, because when they test the cancer, some cancers are more aggressive than others.
Mhm.
Mine, there is a score they give to the cancers to know if they recommend chemo or not. So mine
Right.
had a score that needed chemo. And so I was able to get that to help reduce the risk of me getting cancer again. Yeah.
Oh.
But
So
going back to, oh, sorry. Go ahead.
no, go ahead. Go ahead.
I was just
Yeah.
gonna say, going back to your question of how it has changed, even my life in beyond the personal, it has also really shifted the way I approach my work. Because, like you mentioned, I work in the pharmaceutical industry, so
Mhm.
I work at a company where we make cancer drugs. I have been on all sides of the cancer puzzle. Like when my first exposure and experience really to cancer was losing my dad to pancreatic cancer, right? When I was 17. And then,
Oh.
after that, now being in the healthcare sector, I have been on the side where I'm working in a chemo satellite pharmacy or a chemo center. So I've been on the side where I'm giving cancer patients care. I've been on the side where I'm doing the research for cancer meds. I've been on the side where I'm caring for grandparents with cancer. And then now, as a cancer patient and survivor myself, it gives me great perspective and allows me to make really, really informed decisions about how we should provide cancer care to people. And that's why when I'm not busy with my day job, I am really big advocating for us to build a really comprehensive cancer center in Jamaica, so that we will be able to have the same luxury that I had to bring that quality care to Jamaicans at home. And it
Right.
doesn't mean that when you get a diagnosis, you have to fly out to have a chance.
And we're gonna touch on that topic, the cancer center. But can you go back a little, rewind? Can you share, if you may, the story of how you found out about your dad and his cancer? I know it's not the same thing, but it is cancer, and we're on the topic of cancer. So can you share a little about that?
Sure. So, it was right after I moved to the US for college. And so I was here, and my dad, he was sick. He had done this surgery before I left Jamaica. And I knew he was sick, but in his words, everything all right, I'm a good man, just pray for your father, oh my God. And that's how he'd tell me. So while I talked to him on the phone, I had no idea that the sick that he was sick was cancer. And one of the big reasons I think that he didn't share that he had cancer was really maybe trying to protect me and my siblings at the time, because none of us knew. But at the same time, I think there was also this stigma in Jamaica. When people
Yes.
hear cancer, people think dead, Lord the mother dead, and nobody wants that kind of energy. You know what I mean? So people tend to hold their cancer diagnosis secret and don't share and don't talk about it, because somehow they feel like it's something bad. And
Or
yes,
something that can be passed on like a COVID.
right, and cancer
Yes.
is not contagious.
Yes.
There you can touch somebody with cancer and suddenly you get cancer. So
Yes.
it's just these stigmas, and so I think for me, I found out my dad had cancer after he died. So you
Wow.
just think about that. After the fact is when I knew cancer was the cause. And
Mm-hmm.
that has had a profound impact on me in terms of my desire to really make a difference and make
Mm-hmm.
sure that when people hear the word cancer, they don't think death, right? In Jamaica, we can change that narrative. It
Mm-hmm.
doesn't mean that you're going to die. I am here as a testament to the fact that we can survive and thrive after cancer. You saw me a year and a half, 2 years ago. I had all my hair is gone, my eyelash, my eyebrow, I had none. But we come back, we heal,
Mm-hmm.
and we recover. And that is something that's possible if we have the access to the right care. And that's what I want for Jamaica.
Yes. And so we're going to step on the topic a little bit of how has the breast cancer journey shaped you, and also some lessons that you took from your treatment and recovery and so on.
Yeah, I think some of the biggest lessons is advocating for yourself. So as a patient or, in any walk of life, we have to learn to speak up for ourselves. We have to learn to know how and where to find information. And so that's one of the big things where in my cancer journey, I was able to, once I found out I had cancer, I went to one doctor. I met with her and a breast surgeon, and I decided, okay, she's great, well and all good and fine, but I went and got a second opinion. So that's the other thing. Sometimes we're scared, especially if it's a doctor that we've known, we've been seeing them all our lives. We don't want them to feel like we don't trust them, so we don't want to go get a second opinion. You
Yeah.
have to you have to advocate and go find out to make sure that that first course of action that your doctor is telling you, that is actually something that another doctor will say, yes, this is a good approach, or they might give you an alternative. So that's one thing. The other thing too that I've learned through this journey is that we really have to educate not just ourselves but our communities. It's
Yes.
one thing if you know what to do, but does your best friend know what to do if she feels a lump in her breast? Does
Hmm.
your daughter know what breast cancer mean? So
Yeah.
we have to educate each other and share information, because
Yes.
that's the only way that everybody gets ahead and really start to fight this thing. In Jamaica, breast cancer is one of the leading cancers in Jamaica. It's
Yeah.
followed by prostate cancer and then colorectal. But for Jamaican women, breast cancer is a killer. And one of the main reasons why it's a killer is because we're not finding out early.
Yes.
So that's the other big lesson. Please, please, please get your mammograms. And if you have a family history, advocate for yourself,
Yeah.
speak up. Your doctor might say, oh, you're too young. If you have family history, like a mother, an aunt, or a direct relative that have cancer, you need to get checked out, right? And
Yeah.
that brings me to the back, like full circle moment of why it is so important that we don't keep it to ourselves, that
Yeah.
you not because your family need to know. And even within families, we're not sharing our medical history.
Yes.
And
That's right.
we need to know if our grandmother had cancer or if our auntie had cancer, because that's how you'll know that maybe I need to get screened earlier than another woman who has no risk factors and no family history, right? Because that's what's going to save your life. The earlier you catch a cancer, the more curable it is. I was
Yeah.
able to be cured from cancer because it was early. The later you find it, you're just really trying to help people maintain a good quality of life. It's much harder to actually treat at that time.
Right. Right. So, you've worked in both US and the international space in the healthcare sector. What are some of the biggest challenges that you believe we have in Jamaica as it relates to care, cancer care, and treatment?
I think one of the biggest challenges that we have right now in Jamaica, I think, is the access, right? There are about 5 different hospitals in Jamaica that actually specialize in cancer. So you have some specialized services around cancer care. And those 5 hospitals are either in Montego Bay or Kingston,
Mm-hmm.
right? So what
That's good.
about the rest of the island? What about our
Central
St.
Jamaica,
Elizabeth? What about Southfield and Treasure Beach and
Mandeville, Central.
it's
Yeah,
exactly right. So
yeah,
access. And imagine like cancer, the treatment for cancer is such that you're not necessarily sitting in a hospital all the time, right? You will need to go get chemo. Let's say you have chemo and you have to travel so far to get that 1 hour or 2 hour infusion and then travel back when you're so tired and weary from the treatment. The access is one thing that's a huge challenge. So we really need to have a more centralized and more comprehensive cancer care services. The other thing that Jamaica and this is something that's very near to me because of the field that I work in, uh,
mm-hmm.
is that we have things called clinical trials. Now, hear me out before everybody start clinical trials.
Yeah,
No, that is the way that we get drugs approved, like medications, is to
yeah,
do clinical trials to make sure that this particular medicine works in this particular population. No, majority of the medicines that we're using to treat cancer in Jamaica have never been tried or tested on people in Jamaica, right? During the
oh,
clinical trial phases. So
oh,
Jamaica needs to build our capacity to be able to do clinical trials. That way, when a company says, yes, this medication works, we know that it has been also tested and tried in our population. Because that's
mm-hmm.
the thing about medications. It's very unique, depending on the type of food that's predominant to a
Yes,
particular country and all these different factors. So it's important that we build up our research and clinical trials capabilities. And the last thing that I'll add, I think the maybe the most important is community awareness.
yeah,
So you have the Jamaica Cancer Society, and you have other organizations that have materials that can educate people about what to do, how to screen, when to screen for cancer. We need to educate our communities. Through our churches, we can have health screening days, like all these different local grassroots organizations. It's going to take a village because we have to try to change the perception that people have about cancer, because that's the only way we're going to have people being willing to come forward and get screened or come forward and get treatment. Right now, Jamaica don't even know how much people or the real prevalence of cancer in the country,
mm-hmm.
because half the people who have cancer hide it. And
Yeah.
half the people, they don't go to get the care.
And
So
there's
it's
no statistic.
yeah. So they have these that we call them cancer registries. So
Yeah.
Jamaica needs to also, build upon firming up our cancer registry so that we can know and be able to advocate to the government to say, well, you know what, we have an X number of breast cancer every year. We need you to put more dollars towards breast cancer care, or we need you to make policies that help people access this care because here is the statistics, here's the numbers. So we need that information to drive the change. It's not just, word of mouth. We have to get the data there as well.
Sorry about that. Yes. So ah, let me tell you, I love your passion. I just love how you're fiery about when you speak about breast cancer and breast cancer awareness and yeah, the advocacy that you've been doing. Tell us a little bit more. I know you can't speak too much about this, but tell us a little bit more about the cancer treatment center that you're planning to build here in Jamaica.
Well, we are advocating. I'm working with a lot of different folks, basically trying to set the groundwork to advocate to have a cancer center built in Jamaica.
All
I
right.
think there's a lot of energy and support around it. And
Mhm.
as soon as there is some more firmed up commitments. We can definitely make more statements on it, but it is early days. But I'm happy. I'm so excited and happy by the energy and the interest that our
Mhm.
local government stakeholders, our local business stakeholders, our local universities have shown, and the support that is being pulled right now to make this a reality. I think a lot of folks on the ground in Jamaica and people in my network here in the US are very fired up about the notion of getting a cancer center built in Jamaica. And it's bigger than just us, right? That if you look throughout the Caribbean, we don't have what we call a comprehensive cancer center within the region, and that's
Yes,
what's needed. Because the comprehensive cancer center is going to address a lot of those challenges that I talked about before. It's going to help us with the research we need. It's going to help us with the treatment and facilities to care for our people in a high quality way. We have the talent, Jamaica is not
yes,
short of the talented
yes.
healthcare professionals. We have the talent. What we need is the resource and the tools to do it.
So it's going to be a comprehensive center, which means that it's not just Jamaicans, but people from the Caribbean will be able to benefit from it as well.
Well, the comprehensive cancer center, when you hear a cancer center is comprehensive, it's usually referring to the fact that it has more than just like the hospital part. So when you
Right.
think about cancer care, people think about a hospital. You go for surgery or you go for chemo and you get the medicines. But
Yes.
when you think comprehensive, it means that as a cancer patient, when I walk into that center, I am going to get help with more than just my cancer. They're
Mhm.
going to look at, okay, does Arnisha have a place to live?
Yes.
They'll give you support with the social services that you need. Is Arnisha depressed because of her cancer?
Yes.
No, they'll give you the help with the mental health support that you need. They're going to look at, does Jamaica have the right researchers and the training? So they're going to bring in doctors and trainees to make sure that we're building our capacity to treat cancer. So it's going to include that full wraparound service. But to your point, the good thing about this is that the idea is that this center starts in Jamaica but doesn't end there, and it becomes a place for folks in our region to be able to also access, and eventually for us to expand to the wider Caribbean islands. That's my vision for this.
Yes.
And I think it's something that is very ambitious. But listen, I beat cancer, I can do anything. So we're gonna make it happen.
I think so. I think so. I can't wait. Yeah. So, with your background in leadership for young women and professionals who look up to you, what advice would you share about finding purpose in their own career?
No, I love this question. I think for me, everything I've done so far, there has been one common thread. So, like I mentioned, I started my career at the United Nations. And then, while I was doing that, I was an adjunct professor teaching, and then became a pharmacist, and now working in this space where I work now, not on the drug development side of things, but on the philanthropy side. So, my
Mhm.
day job is literally finding healthcare providers, doctors, and professionals around the world who are doing really good work to bring access to care to people who need it, and giving them the money and the funds to do that, and helping them build the infrastructure and the capacity to do that. So the one common thread throughout all my career experience has been wanting to be of service. I think we're all put on this planet. Not everybody believe in God, but I'm a firm believer in God. And I think God put us here to do more than just, take care of ourselves and be just about, this idea that it's just you and your family and that's it. I think we're here
Mhm.
for a bigger purpose. And so
Yeah.
I have found purpose in my career by being able to impact the lives of others. And I think that's my message to young women out there. As you think about what you want to do in life, think about having something that will have meaning and being of service to others. Being of service is not it's not a bad thing, honestly. It's something that can really give you that why do you wake up in the morning, why are you going to work? And you can find purpose in the work that you do as your job, but you can also find purpose outside of that. A lot of there are opportunities to volunteer, there are opportunities to give back, there are opportunities to really help one person. It doesn't mean you have to help the whole village. You can
Yeah,
just help one person, and
yeah.
that is being, I think, living up to our true potential of what God intended for us.
And you're very humble. Guys, she's just being modest, you know. She has worked for the famous Ban Ki-moon. All right. Tell us a little bit about, you know, what you did at the United Nations when back then when you were working at the United Nations.
Oh my gosh, it was a fun time in life. I still look back fondly. But when I worked with the UN, so at the time, Ban Ki moon was the Secretary General, and he created an initiative called Sustainable Energy for All. And the purpose of this initiative was to make sure that when the sustainable development goals that the UN was creating in 2015, that when those goals were set, that energy was among those goals. Now, for people not like steep in the international development space, I'm going to put it in very plain language.
Yeah.
If you have a goal among the SDGs, or the Sustainable Development Goal, what it meant is that there would be a lot of attention and resource that goes towards that particular area. So, for example, there's a goal to end hunger. So it
Mhm.
means that every country that's a part of the UN was saying, yes, I'm committing to end hunger, and I'm going to
Mhm.
put my money where my mouth is and actually
Yes.
try to end hunger in our individual parts of the world. So
Mhm.
my team that Ban Ki-moon put together, our goal was to make sure that sustainable energy access was one of those goals. And
Right.
we were able to successfully do that. It was a lot of late nights and hard work to get that done, but I am so proud that we got that goal on energy. And I can give you an example of what that means in like real people, real impact.
Yeah.
You know, when we were advocating for this goal on energy, and this was in 2014, 4.6 million people were dying every single day across the world just because had what we call unclean cooking and heating service. So if you
Mhm.
grew up in St. Elizabeth, I'm sure you know about coal pot, because I know about coal pot. We used
Yeah.
to cook on coal pot sometimes
Yeah.
outside or whatever back in the day. But
Yeah.
that's for some people it's not an option. Across the world, people are using different sources to cook and to heat their homes, and it's causing them to die from like asthma and other respiratory illnesses. 4.6 million. And
Yes.
so after we got the goal on energy, and a lot of that advocacy that I did was to say, hello, we need to make sure that people in poorer parts of the world have access to cleaner methods to cook, that they have access to cleaner ways to keep their house warm in the wintertime. And when you look after we got the goal and we got resources and attention, that number dropped to 3.8 in 2017. That number
Wow.
dropped to
Thank God.
3.2 in 2020 and has continued to come down since. So
Yeah.
sometimes people look at the UN and we have that. We won't get into a UN discussion, but
Yes.
people have different opinions about like the value and the impact that it has. But that's one way that you can see some of the work that I was able to do there. Um,
We're inspiring young people here tonight, you know, especially young women. So so we're getting into it. We're getting into it,
okay,
Ornesha.
I
All right.
love
So
it.
you also worked at the New York Academy of Medicine, right?
So yeah, so this is not so much work. This is more
Yeah.
of a volunteer
Mhm.
opportunity that I do. So the
Yeah.
New York Academy of Medicine is a public health institute. They're over 175 years old and have been a huge part of the health system, building the health system here in New York and in the wider US. And
Mhm.
so I serve as the chair of their rising professional group. So it's like the young professionals, of the
Right.
So I serve as the chair of that group, and we work on different public health initiatives. So
Mhm.
raising awareness about different, climate, the importance of climate change mitigation and how climate change is impacting healthcare. So
Mhm.
that's one thing that we sometimes don't think about. But we really are in times where we have to address climate change if we're going to really be moving healthcare forward in a meaningful way. So I get to work on some fun projects like that through that volunteer opportunity with the New York Academy of Medicine.
Wow. Yeah, so when we get my Jamaicans on here that are really, really doing great things global, locally and globally, I have to highlight them and pick them up.
No,
So
sure.
I hope you don't get mad at me for getting into so many
No,
things.
not at all. No, it's fun. It's nice to talk about it. And like you said, we're in the business of inspiring. And I think
Yeah,
I'm so thankful for you even asking about beyond cancer,
yeah,
because I think that's one of the things that when you share that you've had cancer, it's almost like people look at you, know that that's all you are. It's just the cancer. So I love
yeah,
that you're asking about other stuff in my life, because I
yeah,
want people to know that there is life after cancer. You
yeah.
can still do all these cool and fun stuff, and life gets even better after cancer. So I am super, just excited to share and let people know that it doesn't stop you. It doesn't have to stop you. There is hope. We can defeat cancer, but we can also go on to do amazing things as well.
That's true. And getting a little personal now. You're a mom. I'm also a mom. What are some of the things that you would you can share with me as a mom? My daughter is only 12. She's going on 13. Just being self-aware and checking herself. We speak about the fact that it's mostly women over 40, 45, and older who have breast cancer. But I've heard of cases of breast cancer in women as young as 18 years old. Yeah,
Yeah, no, I think you bring up a really good point. And as a mom, like that's the first thing that went through my head when I got diagnosed, like what's going to happen to my daughter. So I have one daughter, she's 13, so not too much older than your daughter as well.
yeah,
And it's something that we constantly, at least I constantly think about, making sure that she is equipped with the information of knowing how and when she needs to start getting her routine checkups. I would have to go do a little bit of research, because to be honest, I haven't looked into like what's the age recommendation now,
yeah,
especially when you have a direct relative like a mom with breast cancer, for
yeah.
a screening to start. So that's something I'll have to check on. But I think I'll make sure you get the information so you can share it with your viewers even in another
Mhm.
segment. But it's important for us to make sure that our kids understand what cancer is, because one of the things that people so out there might worry about, oh my gosh, like is it contagious? Well, your kids are sometimes think, and they're old enough to wonder, well, because my mom has cancer, does that mean I'm going to get cancer? And
Yes,
how do you
that's
have those conversations with them to
yeah,
one, reassure them and let them know cancer is very, I mean, the scientist in me thinks of cancer as just a bunch of cells growing out of control. Like that's
yeah,
what it is in reality. And different things might contribute to it, but the one good thing is that we know some of those risk factors. We know some of the things that can increase your risk of getting cancer, and we can reduce those risks by actually mitigating. Like, for example, when it comes to smoking, that's a
mhm,
typical one that smoking might increase your risk of lung cancer. But
mhm,
you have non-smokers who still get lung cancer, right? So it doesn't mean that's the only risk factor. We know about our diet, we know about obesity. One of the things that I stress with my daughter is health, being active, and being and as kids they're eating more junk than we eat, but you stress that active, being out there doing a sport, making sure, because I think for me, and I really believe this, I don't have any scientific data to support it, but I really believe that I was able to really get through surgery and chemo without um, losing my energy and spirit, because I was in such good shape. I feel like when I got cancer, I was in the best health and shape of my life at that time. And I'm
Mm.
so happy, because somebody might say, well, what, you don't, you feel bad? You did all the quote unquote right things when it comes to health and you still got cancer. My answer is always no. I felt lucky that I did not have any other comorbidities or other disease or underlying health issues that would have made treating the cancer harder. Because
Yeah,
that's the thing we have to think about too. The healthier you are in general, the better you'll be able to fight the unpredictables like a cancer, right? Because if
yeah,
I had something, let's say diabetes or any other disease that could complicate how they're able to treat me and make it more difficult for me to heal, those things would matter or factor in. So it's really important to make sure that for your kids, you're encouraging them to be in good physical health. And the
mhm.
last thing I say, because I know I talk a lot, so the last
No,
thing
no, we love it, and I'm sure the audience love it.
is
Yeah,
the mental health.
information is good.
Mental health. Check in with your kids on their mental health. Find out, ask them how they're doing and really stop to listen. You know,
Yeah,
sometimes your kid come home and they're running to tell you who said what and what happened at school. You might be in the middle of something, but stop. Spend the 5 minutes and listen. It matters way more than you think. I know we all in the phones and we're scrolling and we're there but not present. Take that 5 minutes each day to really hear how their day went,
yeah,
because that will allow them to come to you when they're scared about other things or just for information. It will open up the ability to talk to them and to be able to cue in when they get a little quiet and they're retreating more than normal. You'll be able to notice that. But if you're always too busy to even just talk and check in with them,
yeah.
you're already setting yourself up for them to basically feel alone.
And you know what? I'm gonna share a story with you. When my daughter was going to primary school, there was this boy who so-called liked her, and he didn't know how to approach her. So what he would do would like stop her on her shoulder and run and stuff like that. And one day, the boy took up a rock, a small rock, and threw at her, and it hit her on her breast. And let me tell you something, all kind of things start. Because she came home with it, it was bruised a little, and she was
Mm,
crying. It was hurtful. So,
really?
I had to take her to the doctor. They did the examination. They did a ultrasound and stuff like that. And even months after, I think a year after too, we went back and we did it again, just to see
Mhm.
if everything was okay. But I can tell you during the whole time, because there were times after when she would come to me and say, "Mommy, she's still feeling a little, sticking
Holiness or
something.
mhm.
Yeah, it's tender and stuff like that." And I can tell you it was so nerve wracking, and that was not that diagnosis, but yet it was so nerve wracking. So what I wanted to ask is that um do is it something that I should be worried about? Do you think? Because it's been on my mind from then, from it
No.
happened.
It's hard to sit here from this standpoint, and you've taken her to medical doctors and so on, but something like that is not the typical risk factors that we worry about when it comes
Mm,
to breast cancer. There are other factors that we think about, especially, I can tell you, if with breast cancer, you'll hear about hormone receptor positive breast cancer or the human growth receptor or HER2 receptor positive breast cancer. And one of the things that makes the risk increase for a lot of women with breast cancer is when you're exposed to estrogen, just more
yes.
more early, frequently or for longer than others. So, for example, women or kids who start seeing their periods super early, and that they tend to be at an increased risk for breast cancer just because of their exposure to estrogen. That's not to say
Yeah.
if your kids start seeing their period
Yeah.
early, that means definite, but it's just one of the
Hmm.
risk factors. So we worry about
Hmm.
stuff like that. When it comes to, you know, physical injury like that to the breast, that typically is not what we're looking for as far as risk factors. But it's good to keep an eye on it, and you sound like you've been doing that. So
I
I would,
have.
yeah. So I think that's one great thing. But you definitely, the question allows me to get into a little bit of what I want people to also know about breast cancer in terms of this hormone receptor and that link with estrogen, like women who take certain birth control, so we have to be there is a real risk when you're exposure to estrogen, because a lot of breast cancers, it's almost, to put it in lay terms, is like the estrogen feeds the cancer. When you're an estrogen receptor positive cancer, it means that estrogen can actually cause that cancer to grow faster. No, because there are different types of breast cancer, it's not just
Yeah.
estrogen, there's also progesterone that could help. But here's the thing, what I want women to know is that when you, or if there is a woman out there who should, God forbid, but it's happening, 1 in 4 of us are getting diagnosed with breast
Hmm.
cancer. 1 in 4 women. I know that statistic sounds crazy, but that's where we are. If you do get diagnosed with breast cancer, here are some things I want you to ask your doctor and to find out, because this is going to help you know how best to treat it. You need to ask for a genetic test. Genetic
Yes.
testing can help with figuring out how best to treat the cancer, right? The
Yes.
next thing you need to ask, and most physicians, they're going to do this anyway, is find out what type of receptor this cancer has. Is it that HER2? Is it that estrogen? Is it that progesterone? Because what this will do is allow us to know how to treat it. Some
Yes.
people, and it's very, very common, and unfortunately, very common in Caribbean women to have what we call triple negative breast cancer. And when you have triple negative breast cancer, it's a little harder to treat because it means it's not positive for that hormone where we could just cut off the estrogen supply. It's not
Yes.
positive for that PR where we could just cut off that supply, and it's not positive for the other HER2 that we have medications that can block that, right? So
Yes.
triple negative is a little trickier, but once you know you have that's information is empowering, because there's a lot of research that a lot of people here in Jamaica and in the States are doing to find out the best ways that we can treat triple negative.
Yes.
So it doesn't mean all is lost if it's triple negative, but it does mean you have more work. We definitely have more work around the treatment space when it comes to triple negative. But you want to ask your doctor those questions, because that's really going to help you set yourself up for success.
Thank you. Thank you for that. We're really learning a lot here tonight. Um, if anyone have any questions, you can you can post your questions in the comment section, and Dr. Watson or Nisha will see how best she can answer your questions as it relates to, if you have a question about your career field, if it's about breast cancer, because we're on the topic of breast cancer. It's Breast Cancer Awareness Month all over the world. Um, if you have a question, you can just post it, and she'll try to answer it as best as possible. But until then, um, Dr. Watson, I'm gonna call you Dr. Watson, because it rolls easy off the tongue.
I told her to just call
Yeah.
her Anisha, but I'll
Looking ahead, what's your vision for the future of global equity, and what gives you hope right now?
so my vision, to be honest, is so, I have almost like blinders on, because all I'm focused on right now is getting a cancer center built in Jamaica.
Yeah.
That's the goal when it comes to my vision for a more equitable future. You
Yeah.
know, I don't know. I think I might have shared this story with you, but about a month before I got diagnosed with breast cancer, another young lady who was living in Jamaica in St. Elizabeth got
Mhm.
diagnosed with breast cancer.
Yeah.
And I am here tonight speaking to you and being able to share my story of survival and thriving. But that young lady passed away within 10 months, 10
Wow.
months of getting diagnosed.
Mhm.
And a lot of it wasn't because her cancer was far, far along, and it was just access to the right care.
Yeah.
That for me is something that I don't want to for that next woman to die because she just don't have access to care.
Yes.
And so for me, the vision, the future is all about getting that access to my fellow Jamaican women. And you know what gives me hope? What gives me hope is that I have so many people
Mhm.
already committed, so
Yeah.
many people in the background right now. And I hope it gives everybody who's watching this hope. But we are working on it. We are working on it, and we are going to make it happen because it is too important. You know,
Yeah.
Jamaica shines no matter where I go in the world. Like you said, I've lived all over the world, I've worked all over the world. And the one thing is that Jamaica shines through. I've never been anywhere where they're like, oh, I've never heard of Jamaica. They know us, they love us, and that's for a reason. Our little island is special. Our
We
little
little but with Talawa.
Little but with Taloa, and
Yeah.
there's just a magic about our island, and we have to make sure that all people in Jamaica, all of us, have the same access. It's not about the rich and the poor, uptown, downtown.
Yeah.
We need to make sure that all of us have the same access. So what gives me hope is that that vision is not just mine. What gives me
Yeah.
hope is the fact that so many people share this commitment and are working in the background to make it happen. And I think each of us have a part to play and will play in that. And to the woman out there with breast cancer right now, and I am talking to you right now, please, please, please do not lose hope. Do not give up. Do not feel like this is it and this is the end of the road. To the woman out there who is trying to make that decision, if I need to lose one breast, two breasts, take out the lump, to trying to make the right decision, you know, reach out to us, reach out to the community of women who've been down that path. We are here. We want to support you, and you will get through this. There is a lot that goes with this diagnosis, but you don't have to do it alone. And
Yeah.
that's the one thing I want you to feel. If you're a woman in Jamaica right now wondering how you're going to get through this, please, please reach out. Don't go through this alone.
Yes. How? Anisha, how close or how far? I would say how. Let me say how close. How close are you to seeing this dream become a reality of having the cancer treatment center at a central location here in Jamaica?
I would say it's very early phase in full,
Mm-hmm.
honestly, and it's hard to put a timeline when
Yeah.
you're working with so much stakeholders. But
Yeah.
one, the commitment that you have is that we're trying to make this happen sooner than later. You
Yeah.
know, there are too many people who need it, but it's
Mm-hmm.
still very early phases. We're in the first phases of getting things off the ground in terms of the logistics of it, the feasibility of it, getting the right partners to the table. But what I can say is that given the level of interest and support so far, I'm confident that we'll be able to push through and actually see this to fruition. But Shan, it is really hard to tell you a timeline, and
Yeah.
I
I
I don't
understand.
want to overcommit, but overcommit to the time, but commit
Yes.
to the process and to getting it done for 100%. But the time
Yeah.
is tough to say. Yeah.
I understand. I understand.
Yeah, man.
I see. Sorry, Anthea had a question. Well, she didn't really have a. She said, "What about cancer other parts of the body. But that question is kind of
No, I think
yeah,
I'm not sure, and she can clarify in the chat. But if she means
yeah.
like, is the center going to be focused on or just talking about cancer? Jamaica has other people are getting different types of cancer. I mean, in
Mm-hmm,
my family alone, of family members who've had cancer in Jamaica,
mm-hmm,
it's not just breast, and
yeah,
so there is definitely awareness that a lot of the things that I've said about the breast cancer journey is true for some of
yeah.
these other cancers. But I think we also, I try to focus on breast cancer, obviously, because that's where my experience lie. But it's not to say we're neglecting the other cancers, because the same is true. Like we have to, the mind,
Yeah.
when it comes to fighting cancer, whether breast, prostate, anything,
Mm-hmm,
colorectal, pancreatic, this has a lot to do with how we get through it.
yes.
If you're defeated mentally from you get that diagnosis, it's going to be so hard to get through it. But if you stay mentally strong, which is easier said than done, but I'm saying it because I did it, and the how I did it was not by myself. I had a village. I had people
Mm-hmm,
who were calling me and saying, Anisha, I'm praying for you. And I don't know about you guys, but I felt the energy when they said they're praying. That gave me some hope, some strength. That I had people who were saying, "Ornisha, do you need me to send, like make you dinner? What do you
mm-hmm,
need?" So it was a village, and
yeah,
I told my best friends, my closest friends, that listen, when I got down, because it's tough. You're not always like, yeah, I got this. Some days you're feeling really down.
yeah,
When I got in those mode, the important thing is to have a strategy and have a plan of how to get out of it. So I would tell my friends, like, listen, when I'm happy and things are good, I might not reach out at that time all the time, but when I'm down, I need you guys to get me out of it. So I would call them and I would say, your job is to help me not think about all this crazy stuff now. And,
yes,
and so have a plan, have people around you that you can be kind of like your little shot or a little boost of joy to
yes.
take you out of those down moments. Don't do it alone, is the big overall message, regardless of the cancer type.
Yeah, those are some great advice. Petrina in the chat, Petrina Gardner, she's asking, at what age can you do a mammogram?
You can do the mammogram. Well, the recommended age is for women over 40, but you can do a mammogram. For example, like I was saying before, if you have family history, you can go into your doctor and actually discuss that with them and ask them to get it sooner, right? So if you
Mm-hmm.
have certain risk factors or strong family history, it's recommended that you get it sooner. But right now, the guidelines that we have safe for women 40 and over.
Okay. So you hear that, Petrina? She's saying 40 and over for now.
But you can
Yeah.
go and talk to your doctor if you feel like they, or if you suspect, if you feel a lump, forget it.
Yeah.
The age is not a part of the conversation. If you feel a lump, you're going to get that mammogram,
Hmm.
regardless of your age.
I'm close to 40, and my doctor is recommending that I get one because I was in an accident a year ago, and the seatbelt tug on my, where was it? Yeah, my left breast,
Mm-hmm.
and it was severely scarred, and it was numb. It it
Wow.
hurt for a long, long time. So they recommended that this year I should get a mammogram done.
Yeah.
Um, I'm pretty close to 40, but I'm not 40 yet, so I I don't think they're gonna turn me away.
No, they won't turn you away. And
Yeah.
especially if your doctor is the one referring you and sending you to get it,
Hmm.
you won't get turned away. So
Yeah.
and for other cancers, there are other screenings that you can do. So if they're the men in your life, you encourage them to go get that prostate screening for,
Hmm.
their the people the especially like your peer for the older parents or older
Mhm.
relatives,
Yes.
encourage them to go do that colonoscopy. A lot of these cancers, when you catch them early, colorectal, like I think I mentioned it before, but colorectal is the third most prevalent cancer in Jamaica. And that one, if you do a colonoscopy when the time comes to get it, if they find, we call them polyps, if they find a polyp, because the colorectal cancer developed from this polyp, if they
Yes.
find that, they can remove it, and that will actually reduce your risk of developing the cancer. So that
Mhm.
screening can save life. So just like how the mammograms save life with breast cancer, there are other screenings for other cancers too.
Yes.
Ask
Yes.
your doctors. I think this is one thing. When I was growing up in Jamaica, everybody was like this to doctors. The
Mhm.
doctor is like sitting up here, and you don't
Yeah.
want to ask them any question. Ask your doctor questions. Write
Yeah.
down your questions before you go if you think you're gonna forget, so that you ask them everything. It's their job to talk to you. And
Yeah.
sometimes we're scared. We think the doctor know everything, and they tell us so. Ask them. They're just like how our kids love to say, "But why, mommy? Why?" Like
Yes. Yeah.
we need to make sure that we are asking our doctors these questions about, oh, am I due any kind of vaccine right now?
Mhm.
I do any kind of screening based on my age, based on all the risk factors, doc? Do you think there's anything that I should be doing with my lifestyle management? There's certain things that your doctor can help you prevent and mitigate.
Yeah.
Work with them, talk with them.
Ask about pop smears.
Yes, it's a
Yeah.
two-way stream.
Yeah.
Exactly. Pap smear is another huge one.
Mhm.
Cervical cancer, the second leading cancer for women in Jamaica.
Yes. Um. Thank you. Thank you, Ornesha. You're welcome, Anthea and Katrine. So we have Homemade for Purpose. She's asking, she said she came in late. What are the symptoms apart from the lumps? So that's for breast cancer.
Yeah, so with breast cancer, the symptoms can vary, right?
Mhm.
So, for example, the signs, the lump you consider a sign. The symptom is like maybe if you feel a pain or the breast swollen or a discoloration. So
Yeah.
it varies for different women. For me, I literally had no symptom. There was no
Mhm.
tenderness, no pain, no nothing. It was just by chance I felt this lump and decided to go check it out. For other women, there is tenderness, there is discoloration. Maybe there was a part of the skin that starts to look a little bit wrinkled or changing in texture. There are different things that will happen. But the important thing is for you as a woman to look in the mirror. I don't care how much of us don't like looking at ourselves. Look in the mirror, get to know your body, look at what every little crevice corner, so that way when something changes, that's the main thing we're looking for. When something changes and is a little out of the norm, that's what you want to focus on.
Mhm.
And for sometimes people always say, I don't know what to feel for when I'm doing a breast self exam. When you're doing that breast self exam, the more often you do it, the more you'll know what your breast normally feels like. And for a
Mhm.
lot of women, especially under this underarm, near your underarm, a lot of
Mhm.
women don't have like smooth skin there. So you feel it maybe feel a little lumpy, and you say, is that what I'm feeling for? My advice would be to feel for both. And if it feels generally the same on both sides, it might not be an issue. But when
Mhm.
things start to feel different, or maybe a month ago, you never feel this lump that you start to feel now, it's those are the things that you're looking for. So it will varies. The big the long My long-winded answer is that it varies, but the
Yeah.
important thing is that if you start to make sure you know your body, you
Yes.
will know when something starts to change, and that's when you want to talk to your doctor.
Yes. Thank you. Homemade for Purpose. I'm going to come to your question, but I wanted to ask, you spoke of some of the symptoms. Um, could a woman who is not of childbearing age, meaning she has passed that age, and having milk in her duct, could that be a symptom as well of breast cancer?
I don't want to say yes, and I don't want to say no, and here's
Yeah.
why. When we are, let's say you're going into menopause, that age range,
Mm-hmm.
there's a lot of hormone imbalance and hormone
Yeah.
disturbance, you call it. So there
Yeah.
could be different reasons for that happening, right?
Mm-hmm.
The type of cancer I have is called, and was or had, is invasive ductal carcinoma. So it's in the duct. So those same duct that usually bring the milk,
Yeah.
that's where my cancer was. So there are different places that the cancer can be in your breast. So the symptom might be, or the signs might be a little different. But a lot of time when we're in those age range, that
Mm-hmm.
our bodies changing, or we're transitioning, whether from like puberty into adulthood, or going through our mid later years and transition into menopause, the hormones in our body change, and that can even change the look and feel of our breast, and things that are, a lot of things can happen there. So that's why the important thing is not to assume, not
What
to
to get?
sit and wonder, but you go get it checked.
Yes.
So if there's something unusual happening, you want to get it checked, especially at that age, because
Yeah.
like I said, the exposure to estrogen is actually something that impacts our risk factor for getting breast cancer. And the older you are, the longer you've been exposed to estrogen, right? So
Yeah.
that's why typically a lot of older women, that's why my doctor said to me, "Oh, you're very young for this type of cancer." But
Mm.
like we discussed, let's not focus on the age so much. Let's look at ourselves as individuals and
Yeah.
actually focus on our own risk factors and signs and go get them checked.
I know an older woman who has been having these symptoms, but she's afraid to do the mammogram.
Here's
And
what should I tell? Give her my number, okay? I need get. I know I'm joking, but not joking. Please, if she's willing to talk, give her
yeah,
my number, because I think it's so important that
yeah,
we don't let fear hold us back.
yeah,
The biggest thing that I mentioned, if the viewers take away nothing else, please take away this: early detection saves lives. So the earlier you find out what's going on, the better your chances are of beating it, if it is in fact cancer.
yes.
So the quicker it is, stop the foolishness with "me afraid" or "I'm not want to go find out" and this and that.
Hmm.
Please don't let that hold you back.
Hmm.
We
We
have
have two questions. Sorry, we have two questions in the chat. I don't want to go too far without. All right, so we have a question here from Homemade for Purpose. Before I get to that question, Anthea is a cancer patient. She said she had stage 1 cancer, and her cancer was. Can you pronounce that? Are you seeing the chat?
I am not. Let me see.
Carcinosoma
Carcinoma.
or something like that.
I can't see the chat.
Oh, you're not seeing the chat?
It's just
Oh,
showing a private chat, but it doesn't show the so
okay. All right. So, Homemade for Purpose was asking, what are the benefits and limitations of a mammogram?
okay. So the biggest benefit of the mammogram is to ensure that if there's any sign of a lump or any sign of cancer, that we can detect it early. The
Mhm.
mammogram is like a x-ray for your breast, and for lack of a better word, right? So it's really an imaging. So when they do the mammogram, they're able to look at all those little ducts and all the tissues in the breast, and they can identify if there is anything unusual there. And if
Mhm.
there's anything unusual, that they try to do what we call a biopsy, which is like a little
Yes.
needle to go in, take out a little piece of that cell, so we can test it to see if it's cancer. But what the
Right.
mammogram does is give us a starting point to catch things early. Because, like I mentioned, early detection does what? Save lives.
Live. Yep.
We have to
Yep.
catch it early. So that's what the mammogram does. In terms of limitations of a mammogram, um, It's not fun. It's uncomfortable because they're literally, the exam is gonna squeeze the breast down a little bit,
Mm,
but it's bearable. It's bearable. You can do it and it could save your life, so it's worth it. The other
yes,
limitation of mammogram is that, like I mentioned, especially in us black women that tend to have what we call dense breast tissue, sometimes the mammogram is not able to see everything clearly. So you might have to do some follow up examinations or testing. But the biggest thing and why it's worth it is because we catch it early, we can save your life. We
right.
catch it early, we can cure breast cancer. There's not a lot of cancers that we're treating to cure.
Yes.
Sometimes we're just treating to keep it from spreading, keep it from, making your quality of life bad. But when it comes
Mm-hmm.
to breast cancer, we treat to cure. I am
Yes,
sitting in front of you saying I don't have breast cancer anymore. I am
yes.
cancer free. That means
Mm-hmm.
I am cured of that cancer, right? So we can
Amen.
do that when you catch it early.
Yes. All right. I'm gonna come to your question, handmade for purpose. But I don't think, Anisha, do you know the cost of to do a mammogram in Jamaica? I don't think you
It's
do.
around, actually, I do. It's
You
around
do?
$6,000.
Yes.
And
Oh,
it's around $6,000 to do a mammogram in Jamaica. And the
yeah.
reason why I know this is because a friend of mine
Mhm.
she was raising money for her 44th birthday to raise money to do for 44 women to be able to do mammograms in Jamaica. So it's around
Oh.
$6,000. And for depending on where you are, what you're doing in life, that's a lot of money. That's not
Mm-hmm.
cheap. So
Mm-hmm.
for people who don't have the money to go do that mammogram, there are resources. You can start with the Jamaica Cancer Society. Reach out to them, find the website or their number, call, tell them I'm a woman who needs, or if, I need to do a mammogram based on XYZ. And I need the help to pay for it. And if they don't, they will point you to the resources to help you with that. So don't just sit there because of the money. I know $6,000 might be a lot
Mm-hmm.
of heavy lift, but really there are people and organizations that you can reach out to to find out if there's support to
Mm-hmm.
get that covered.
But and you know what, handmade for purpose? There's someone who I know of who had breast cancer who told me that with health insurance, with her health insurance card, she was able to get screened at the University of the West Indies for $700.
Yeah, there
Mm-hmm.
you go.
So
That's wonderful to hear.
yes, yeah. So handmade for purpose was asking, how can lifestyle factors impact breast cancer risk?
So, lifestyle factors, like we talked about a little bit earlier,
Yeah,
whether
she wasn't
that's
on.
diet, so there's diet, exercise, those are some of the things that we can do. I was saying to Shan before you logged in that one of the things I was happy about when I got diagnosed was that that was a point where I was probably one of the healthiest in my life. I was exercising regularly, I was eating right in terms of what made sense for my lifestyle. I
Mhm,
was doing, like things that helped my mind. It was really taking care of myself. So I felt like I was in the best shape to fight this thing, right?
yeah.
And so that's why it's important, because obesity can increase your risk for not just cancer, but almost every disease out there. when you
Yes.
have when you don't eat right, let's say you're eating a lot of sugar, a lot of salt, you get increased risk to develop hypertension or high blood pressure, or you could get high blood sugar or diabetes. And these types of illnesses actually make it harder for you to overcome it. It complicates your treatment. It's not to
Mhm,
say if you have those disease you can't fight your cancer, but it makes it a little bit more difficult. And those diseases also increase your risk factor for cancer. So the
mhm.
more you can take care of yourself, the more you can decrease the risk of getting cancer. But importantly, the more you can make sure that you're in good tip top shape, ready to fight and beat this thing if you do happen to get it. So
So no
lifestyle is
smoking,
important.
no drinking, just
Well,
a
well,
glass of red wine.
no, they suggest for women like
Yeah.
one or two alcoholic drinks for a week.
Oh, okay.
That's socially okay. And if you're
Mm-hmm.
going out to dinner, you're going out now and then, but don't bother be downing a buckle of rum and beer every day in and out. Alcohol definitely is
Mm-hmm.
not your friend in that sense when you're trying to stay healthy, not just with cancer, but in general. Too much alcohol, too much sugar, too much
Yeah.
salt. These are just things that we all know. And the recommended when it comes to exercise, there's a recommendation that if you can do 150 minutes, so that's about, what's that, an hour and 30 minutes
Mm.
of exercise for the week, that will actually decrease your risk of getting some of these different diseases, right?
Yeah.
So if you spend 30 minutes walking one day, or you spend, and you don't have to block it in times where you make sure that instead of taking the taxi to get down to the store, you walk, or you go we're from St. Elizabeth, like,
Yeah.
there is a million and one place to get out to the green. But if you're not
Mm-hmm.
in the countryside, you find ways to add exercise into your lifestyle, and I
Yeah.
guarantee you it's going to help. And Jamaica, we're lucky, we have access to real green space. A lot of us, we have access to go outside and use a tree, and all these stuff actually help with maintaining your healthier lifestyle. So take
Yeah.
advantage of that.
Yes, I agree. Anthea, who is a cancer patient, she's saying she visits her doctor every 6 months and
Mhm.
she lives in Queens, New York. And
Oh,
she said treatment was very good, surgery was done, chemo was hard. Yeah.
yeah. Well, thanks for sharing that with us. And I'm also in Queens, New York, so we're neighbors. I guess,
Yeah.
yeah, chemo, the funny thing is, and I joke about this all the time, that when it was time for surgery, I was like, come on, let's do it, no problem. But
Mhm.
because as a pharmacist, I learn about all the different drugs, chemo drugs, different cancer medications, I knew the possible side effects. Chemo was mentally the hardest part for me, like getting into, but I got through it really well, thank God. But it was tough, and it's hard for some people because of the side effects. There's so
Yeah.
much different side effects that can happen. So I'm so happy to hear that you got through it, and I hope your journey is continuing to go really well. But kudos to you, fellow cancer warrior. We can do this.
Yes. Handmade for Purpose was saying, does it hurt? But I think you answered that question
The mammogram,
earlier. Yeah.
it is uncomfortable, but it
Yeah.
not kill you. Please, handmade for purpose. Listen, don't let that scare you, okay?
Yeah. So I hope that answered your question. I hope, do you
did
have
we
any more
did we
questions?
address the question that was in the chat about the carcinoma? I just want to make sure we don't miss it.
She was just telling us the type she had. She didn't really
Okay,
have a question. She was just sharing that she had that type of cancer.
got
But
it.
if you have any more questions, we kind of winding down now, so you can
Mhm.
just post it in the chat quickly before we go. Um, I think we pretty much cover everything. Do I
No,
have any more
this was
questions?
this was great. I am so
Yes,
thankful for the opportunity to share, and I hope this helped someone who was listening in, whether you were at the point where you're thinking about getting screening, like handmade with purpose.
yes,
Yes, handmade with purpose, definitely get screened. Don't just think about it if you're at that recommended age, or
yeah,
if you have any reason to think that you may need to go earlier, please do it. It's really not as bad as sometimes we build it up in our head. And for everyone else listening in, just hopefully, I hope this brings you closer to taking care of you and the people around you, okay? Because it's important. We have to beat this cancer battle. Too many people now. Too
yeah,
many people.
yeah. I don't see any more questions in the chat,
Okay.
so I think that's where we're going to leave it for tonight. Okay, let's just read Anthea's. comment real quick. She said, I'm doing great, doctor, and all the nurses are very brave. Awesome, Anthea. So
So
glad
happy
that
to
you
hear
have that
that.
support. Yeah.
Yes.
So is there, winding up now, your final words to women out there, because you are a all round, when I say all rounder, you I remember I have to, I have to go back to this. I remember when I was little and I saw you, and I hear everybody used to talk about you. Oh, this little girl, she's so smart, she's so bright, and I knew that, one day your name would be on the world stage. So I'm so proud of you. I'm so glad that you have chosen this path, and I'm so glad that you shared your story with us, and that you are inspiring so many persons out there, especially young women who might have been diagnosed too, or have not yet been diagnosed, who's feeling a lump and is afraid to go and do the mammogram. And for all the women who haven't done any mammogram, they're 60, 50, and they haven't done one, for just encouraging them. So thank you so much for being an inspiration and for sharing your story with us tonight.
Oh, Shan, thank you so much. And you're really taking me back to the childhood days running around. But no, I appreciate the kind words. I appreciate you sharing your platform and
Yeah,
helping giving me a voice, to try to help others. And my parting words are really just for women and people out there in general to not get caught up in all the myths. There's
mm,
different myths that we hear about. Oh, mammograms cause breast cancer. That's why I'm not getting any. Or once you get cancer, you're dead. All these things are not true. Okay.
yeah,
So, for that reason, I am so thankful that if there's one person mind that I changed tonight to be able to seek the help that they need, or get the help that they want, then I think my night was worth it, and coming on tonight was worth it. If one person is closer to taking that step to go check out yourself, and remember, do the self exams. If you're not going to get the mammogram right away, and I don't care your age, do the self exams. The
yeah,
self exam is how you're going to know your body. And remember, you're starting as a wide circle. You're going around and around from the outside, and you're working your way all the way into the nipple. Do your self exam so you know your breast, so you know that when something don't feel right, you'll know the difference. Okay. So, parting words: don't believe the myths. Cancer is not the end. We can fight this. There is hope. We can do it together. And if you are fighting cancer right now, you don't have to do it alone. You don't have to
yeah,
do it alone. And there's communities and people here who are willing and ready to support. I see some, like, and now I can see
yeah.
the messages.
Nadine in New Jersey. Nad Bless is saying hi. And
Hi.
Petrine is saying, nice listening to you. You make my night.
No, thank you so much, guys. Thank you. I really appreciate you listening in to us, and really put in kind of like life to this. So
It's
thank you.
such a nice conversation. It's almost like I don't really want to end it. And the more we go closer to the end, is the more questions. Some questions are coming to me, and I don't want you to leave before I ask this question. Um, how can, like, deodorants and stuff like that influence us as women getting breast cancer? Because those are some of the things that I've heard about, like the type of deodorants you have to be
Yeah.
careful, like,
I've
yes.
I've I've heard people talk about that if there's a correlation between, like, the aluminum, for example, because some some deodorants might have
Hmm.
aluminum in it. So I haven't seen any research or evidence to suggest that there is a direct link, but that
Hmm.
doesn't mean that there isn't. So I would have to do more research on that. it's not something I've seen any evidence to support so far. I've looked because I've heard this conversation, and for me, being a little bit of a nerd, I'm always going to the journals and the medical resources that I have access to
Yes.
to check. But even people, just the layperson, there is a site called clinicaltrials.org that you can go and see some of the research and the tests and the science around what people are studying. But I haven't seen anything just to make that connection yet. Okay.
Oh, okay. All right. Well, thank you again. And that's
Well,
it. I
we
think
we
that's it
we
now.
we definitely had fun tonight, and I
Yes,
enjoyed the conversation.
definitely.
Yeah.
1 hour and 24 minutes.
Oh my gosh.
Yeah. Like they say, time flies when you're having fun.
Yep.
Definitely true.
No, thank you
So
again.
thanks again for joining. Thank you so much for joining in, viewers, listeners, and those who were in the chat. Good night, Boom Life and Friends Adventure. Thank you so much, Anthea, for sharing your story as well, and Katrina, who said that you made her night. Thank you for joining in. And Handmade for Purpose, go and get tested. Oh my goodness. So, good night, everyone. Have a blessed night and see you next
Night.
time.
Take care,
Bye.
everyone. Bye bye.
Yeah.